We're here today to do a couple of things. First, our organization, the Partnership to Fight Chronic Disease, launched in South Carolina 1 year ago this week, and we had a great year. We're going to tell you about how our partnership has grown and what we've accomplished, and toot our own horn just a little bit. Then we're going to get real. We're going to give you some compelling new evidence that clearly shows why we're still here and why it's so important that the work of the Partnership to Fight Chronic Disease continues. So you might ask, what have we accomplished nationally this year? We have united the country's most influential healthcare reform advocates who have set aside their differences to focus their attention and energy on the singular task of raising awareness of the problem of chronic disease. We have developed consensus solutions based on the best science and served as a clearinghouse for ideas that work. We've helped provide information to the public on the problem of chronic disease and how they can act to support change. We've served as an information resource for journalists covering healthcare policy and its roles in this year's presidential election. We've engaged policymakers from both sides of the aisle, including the top presidential candidates, and called on them to make fighting chronic disease a key part of their healthcare reform plans. And you might ask, what have we accomplished here in South Carolina? Well, on May 22nd, 2007, South Carolina Partnership to Fight Chronic Disease launched with 21 partner organizations. Since then, we've grown to over 150 partners throughout the state, all of whom have committed to making this issue a key focus of their organizations and committed to work together to bring forward lasting solutions. We've built relationships among a large and diverse group of stakeholders: Republicans, Democrats, Independents, healthcare delivery organizations, health advocacy groups, businesses, churches, patients, doctors, and many more who have joined us to promote our common goals. 15 top state leaders, including First Lady Jenny Sanford, the University of South Carolina President Andrew Sorensen, former Superintendent of Education Inez Tenenbaum, Executive Director of the South Carolina Public Health Institute Dr. Donna Richter, and former South Carolina Department of Health and Human Services Director Robert Kerr serve on the South Carolina Partnership to Fight Chronic Disease Advisory Group. We have more than 80 volunteers in our state's Peers Bureau, including healthcare experts and patients who are suffering from chronic disease. Together, they have spoken at more than 150 community and state events. And we've generated hundreds of reports throughout the state, in newspapers, on television and radio, that have shined the light on chronic disease and its impact on our health. Now I'd like to introduce you to someone who's been on the front lines of the healthcare issue in South Carolina for many years, State Representative from House District 66 in Orangeburg County since 1992, Representative Gilda Hunter. Thank you, Representative Hunter.
Good morning, and thank you for the work that y'all have done on a national level. I'm pleased to be here today to celebrate the first anniversary, the start of this partnership. And I think it's important that when we talk about chronic disease, when we talk about health disparities, that we connect the dots and include information for lifestyle changes, behavior changes. Much of the work that I've done here in South Carolina with the partnership and other stakeholders has been in the area of prevention. When we talk about, I'm a ranking member of the House Ways and Means Committee. And of course, when we talk about health care, when we talk about disease, whether we're talking chronic disease, disparities, or any other, one of the underlying factors is the cost of health care. What I have concluded through research and work over the years is that we can't talk about cost containment, we can't talk about keeping the cost of health care affordable and down until and unless we address issues of lifestyle changes, issue of behavior. When we look at chronic disease, for example, when we talk about hypertension, when we talk about diabetes, obesity, all of those diseases to some extent are preventable, can be managed, can be controlled, through lifestyle and behavior changes. I'm pleased to say that while South Carolina is not where we need to be as far as prevention, we are almost light years ahead of where we have been. I'm very pleased that in this very tight budget year, for example, in our state budget, we were able to provide dollars for prevention at DHEC. It is imperative that the Partnership for Chronic Disease, the other stakeholders that John has mentioned in his comments, be around and be allowed to continue the work that they are doing as far as community outreach, education, advocacy, and work with policy and other stakeholders so that we can make a difference. When we look at numbers, like we've heard this morning, and we talk about the fact that women in South Carolina and almost half of the counties in this state are seeing a decline in life expectancy, that is something that should not be acceptable for any of us. I'm pleased with what we've done in state government as far as prevention. We've got a couple of innovative programs that, quite frankly, are very well kept secrets as far as lifestyle changes. But I think that there is always room for improvement. I am focused and intend to, in the event that I come back to serve the constituents of District 66, I tend to focus on prevention and expanding and building upon what is already there at the state level. For those who may wind up hearing comments I'm making that may or may not get edited out, stories, either visual or print, what I would say to you is that you have a personal responsibility to change your lifestyle. It is no longer acceptable for us to continue to do the kinds of things that we do, to practice the kind of behaviors or habits, shall we say, that some of us practice without understanding the full implication of what those behaviors, what those lifestyle choices, the impact they have on our health. We've got to do a better job here in this state, and I stand here as an advocate for the work, partnership, to celebrate with y'all your first anniversary, and to say for the record that I will do whatever I can as an advocate for making sure that the goals of the Partnership for Chronic Disease, that those goals are met, and we need everybody working together to do that. Thank you so much for your time this morning.
Thank you so much.
Oh, you're okay. A team member.
Absolutely.
You got a great team here.
One last accomplishment of our partnership that I'd like to mention today is we've got a new Partnership to Fight Chronic Diseases, first edition of the Almanac of Chronic Disease. The Almanac was put together with the help and support of a number of organizations. One of them is Mental Health America is an Almanac sponsor. They have really helped here in South Carolina, and they really helped make this valuable resource available to all. In these pages, you're going to find some really alarming statistics. Some address the human cost of chronic disease. For example, more than 133 million Americans, 45% of our population have at least one chronic condition. Obesity rates, the major chronic disease risk factor, have increased 250% since 1980. In South Carolina alone, obesity rates have doubled since 1990. If the current trend continues, one in three children born in 2000 will develop diabetes over their lifetime. Other statistics in the report address the staggering economic cost of chronic disease. About 2/3 of the rise in healthcare spending over the last 2 decades is due to the rise in treated cases of chronic disease. Indeed, more than 75% of the approximately $2 trillion spent each year on healthcare in the U.S. is associated with the treatment of patients with one or more chronic disease.